Welcome back. December marks HIV Awareness Month. Here to discuss the effects of the virus and a remarkable story about an Argentinian woman who may have been cured from HIV is Dr. Tim Henrich, Associate Professor of Medicine at UCSF. Doctor, thank you so much for joining me.
Thank you so much for having me on today.
So, this is an incredible story. A woman known as the Esperanza patient, which means Spanish for hope, was diagnosed in 2013 with HIV. Today, scientists classify her as HIV free. Can you tell us more about this study?
Absolutely. This is a very interesting and I think exciting case. This is a woman who was infected with HIV as early as March of 2013. And since that time, has actually not had any virus circulating in her blood or has had detectable virus replicating over time. In fact, she spent many years without taking antiretroviral therapy or therapy for HIV. And despite this, remained completely healthy without any indication of HIV disease infection and was otherwise normal and healthy.
So, research has found that she was cured by her own immune system. Before we jump into that whole thing, can you just explain how HIV affects your body when you're diagnosed with this virus?
Sure. So HIV is, for most people who are infected, a lifetime infection. Once HIV establishes infection through whatever route or means that may be, it inserts its genome or its genetic material into our own host cells. So it actually becomes part of our or the person's genetic material. Once it infects. And it can hide in those cells even with years or decades of antiretroviral therapy. The virus stays part of the viral genome and the human gene as well in our chromosomes, in our genes, and our cells. And if for a vast majority of people, 99% of people that are infected, if they stop antiretroviral therapy, usually within days to weeks, virus will return and we will be able to detect replicating virus in the bloodstream. And that is a typical course of infection. Antiretroviral therapy is very good at reducing morbidity and mortality from disease. People can live very long, healthy lives for decades and decades on daily pills, and now there are now medications that people can take every several weeks instead of every day. But overall, despite the fact that people have treated HIV infection, they're still prone to increased risks of, for example, heart disease or other inflammatory conditions. So even with suppressive antiretroviral therapy, there are still some effects from long-term infection from the virus itself.
So, I would really like to know, how is it possible to be cured from this virus using your own immune system when the virus weakens it? Because that's what news reports are saying, that it was her immune system that kind of cured her from this virus.
Yes, and that's what makes this so exciting, is that we've had a couple of cases of HIV cure in the past, one being Timothy Ray Brown, the late Timothy Ray Brown, or the Berlin patient, that had stem cell transplantation for cancer and became cured of HIV. But this is not something that we can give to a large majority of people. It's dangerous. It has a lot of side effects and toxicities. But what we've seen with the Esperanza patient, and also with a patient in San Francisco over the last several years as well from our own cohort, are these two women are able to essentially not just control the virus with their immune system, but they seem to have gotten to a point where they've controlled and eradicated a vast majority of virus that's hiding in those cells or the reservoir for HIV, to the point where there is no detectable replication or virus in the blood that's circulating that scientists can find. And this is very exciting because it suggests that the immune system itself is able not just to control virus, but to essentially eradicate virus in any meaningful way from their bodies, which leads to long-term. I think what people are now hoping for in these two patients is HIV cure. But what this also tells us is that we can potentially harness that immune system in other people, either through vaccination or through other ways, and perhaps we can achieve cure by emulating what happened in these two patients.
So, I really want to know, how were doctors able to determine whether or not HIV was present in the Esperanza patient? You may have touched on it a little bit, but I've read it wasn't a typical STD test that, people usually get. So, can you tell us what that process looks like?
Absolutely. This is a great question. So, both the Esperanza patient and the San Francisco patient have detectable HIV antibodies, which means that their immune system has seen the virus and has produced antibodies to the virus. And those can be detected in the bloodstream, very much like we would see antibodies to SARS-CoV-2 infection or influenza, et cetera. So, we know that through these tests that the immune system has seen the virus. What is not seen is the actual viral particle itself circulating in the bloodstream, or the genetic material from that virus circulating in the bloodstream. And when the scientists looked in cells, again, this is where HIV will hide. It inserts its genome and integrates into a person's DNA, into their chromosomes. When they looked at billions and billions of cells to look for evidence of that integrated HIV DNA, or that reservoir in those cells, they found very, very little. I mean, very, very, very tiny amounts, maybe 7 copies in over 1.5 billion cells. So really, really small levels. And the virus that was there was not intact. So it was not able to make a replication competent virus. It's almost like it's a fossil of a remnant viral infection from the past.
Now, the Esperanza patient is the second known person whose immune system may have eliminated all the viable viruses from their body, meaning that although it's rare, this has happened before, and you kind of mentioned there was another person. How could this research help with the fight against HIV?
Absolutely. I think one of the things that everybody's excited about in these patients is what is it about the immune system that is able to bring the virus levels so low that it's essentially cured, that there's no chance of this virus coming back and causing a problem without antiviral therapy, or even if people stop therapy. So I think that what we really, really are looking for are find out what is it in the immune system? What is it? Is it a T cell response to fight infection? Is it something else that's able to identify these infected cells in the body and essentially clear them over time? And I think that what that was, if we can find out how to manipulate, how to emulate that immune response in people that normally would not do it on their own, that this would have a profound impact on finding a cure for HIV that's scalable and also affordable for the large number, the millions and tens of millions of people living with HIV.
So, I would consider these situations and several others as medical miracles, considering that HIV still has no set cure. Why is HIV and AIDS such a challenging virus to find a cure for?
Yeah, that's a great question. This is obviously, we have been working for decades to try to find cure for HIV, and it's been elusive, except for a small number of cases, as the Esperanza patient. And I think part of the reason is that the nature of the virus is that it integrates and it inserts itself into a person's own genes and their cells, and those cells can proliferate, they can divide and make new cells over time and carry that genetic material with it. But not only that, that those cells that are infected can look like normal healthy cells, especially if someone is taking suppressive antiretroviral therapy. Those cells can stay quiescent, and the immune system or the body may not even know that there is infection in those cells. And this has made it very challenging, not only to cure HIV, but also to find vaccines to prevent infection, and other discoveries have been very challenging because of the nature of the virus itself.
Now, the Esperanza patient also gave birth to a child last year, and the baby is HIV free. Now, this is not a rare occurrence, as many HIV positive people have given birth to HIV negative babies. Can you just explain how that works?
Sure. Before there was antiretroviral therapy, a significant number of babies born to mothers that were infected with HIV or living with HIV became infected as well. This is before we had AZT, or before we had some of the more modern combination antiretroviral drug therapies. However, if we've learned that if we treat the mothers during pregnancy, and especially around the time of delivery, that we can dramatically reduce the transmission rate to the newborn baby. In fact, it's been years, I think, since we've seen an infected infant or an infant become infected from an infected mother, simply because we can give antiretroviral therapy. We can drive those viral loads, at least the circulating virus, to very, 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 very low levels to prevent transmission. And in fact, it's very, very, very rare now to have someone become infected with HIV either in utero or after birth if the mother is on suppressive antiretroviral therapy through the duration. So it's really dramatic how it's reduced the transmission rate.
So everything going on with the Esperanza patient is an extremely rare occurrence, but the Esperanza patient remains a symbol of hope. Focusing on overall HIV awareness, what are options available to people in high-risk HIV communities, and how can they protect themselves?
Absolutely, that's a great question. I think one of the things that we like to say is that treatment is prevention. Getting on treatment and getting on treatment early is not only healthy for a person who becomes infected with HIV, but it can also dramatically reduce transmission to others. So if someone is on suppressive antiretroviral therapy and they have no detectable viral load in their blood using various commercial assays that you can get at a doctor's office or even other testing sites, that it's actually would dramatically reduce transmission of HIV. We also now have pre-exposure prophylaxis. So for those who may be at high risk of acquiring HIV, if we give a two-drug combination therapy, that can also dramatically reduce the risk of becoming infected with HIV. So I think treating not only to prevent new infections, but also preventing new infections before they become an issue is clearly a really fantastic way to go about thinking about the HIV epidemic here in the United States and throughout the world.
Doctor, thank you so much for joining us. How can people stay up to date, just with you and educate themselves overall on HIV?
Absolutely. There's a lot of resources. The CDC and other government websites certainly have resources you can go to. You can reach out to those of us who study and treat HIV infection. You can see the email address here, or you can talk to your primary care physician, local health department, et cetera. We'll have a lot of information on prevention, treatment, and whatnot.
All right, thank you. We'll
Thank
be
you.
right back with more Open BXRX Tuesday.